Greetings everyone and welcome to today's session of your musculoskeletal system course. This is Dr. Sally and today we're going to be starting on a topic relating to the lower limb. So I'm guessing you guys finished the upper limb at this point. And we're going to be talking about the anterior compartment of the thigh today. So let's go ahead and get started. So, one of the things to keep in mind when you're studying the lower limb is that most of the things that you learned when you're taking the upper limb are essentially going to apply to the lower limb as well. So you're going to have similar divisions in the sense that you're going to have a joint that's connecting it to um, the um, the axial skeleton. You're going to have subdivisions in terms of regions, things like things like similar to the brachium, the forearm, and the lower limb, you're going to have the thigh, you're going to have the leg, and so forth. But obviously, because the lower limb and upper limb differ in function, and there's going to be differences in structure, differences in how things are arranged, and so forth, but the overall idea is the same. So, with that in mind, the thigh is the region of the lower limb that corresponds to the brachium of the upper limb, meaning that it's the first part of the lower limb. It has a single bone. The bone is surrounded by muscles that are divided into certain compartments and so forth. In terms of location, the thigh is found between the hip and the knee joints, so it's the region of the lower limb between those two joints. The hip being the joint that connects the lower limb to the axial skeleton, and the knee being the midpoint joint of the lower limb. The bone that is found in the region of the thigh is called the femur. Okay, so similarly, we have one bone in this region, just like we have the humerus in the upper limb, but here we're going to call it the femur. Okay, now, like I mentioned earlier, the thigh is also divided into compartments, okay? What we're looking at here is a cross-section of the thigh, and you can see that this white circular structure, that's where the femur is located, so that's the bone of the thigh, okay? Now, what you're going to notice is that similar to most regions of the body, you've got the outermost layer, which is the skin, and then underneath that, you've got the layer of subcutaneous tissue that in the thigh is characterized by being or having a very thick layer of fat. All right. And then underneath that, you're going to have this green outline here, which is the deep fascia. Okay, and then that just basically surrounds the entire circumference of the thigh, just basically keeping everything in place. Okay, now if you notice from this aspect of the, okay, and just to give you guys a little bit of like orientation, let's say, okay, this upper part here, or this half of the picture is anterior, and then over here, this is more towards the back, okay? So, from the posterior aspect of the femur here, you're going to notice that you're going to have three green lines that are kind of extending out of the femur, okay, and then passing along until they reach the very circumference or the very edge of the thigh, okay? Now what these are called, or what these are, is, these are called facial septa. Okay, so they're basically layers of deep fascia that extend between the bone or the femur, and then they reach the outer circumference of the thigh. And then what they do is they divide the muscles or the entire thigh into what we call facial compartments. So if you follow, for example, with this one, okay, you'll notice how it reaches this part here, and then you've got another one extending out to this side here, and then we've divided this part into an entire facial compartment by itself, okay? And then you've got another one extending out here, going all the way to the back, and then what it's done is it's divided this into a separate compartment and this one into a separate compartment. And notice how each compartment has its own set of muscles, and then each one has its own nerves, it has its own blood vessels, so you've got arteries and veins here, Same thing applies to this region. You've got separate arteries, separate vessels, separate nerves. So each muscular compartment has its own structures. Okay? And like I said, this is anterior, so this region here. So obviously this is going to be the anterior compartment. And then back here, this is going to be called the posterior compartment. And then the third compartment of the thigh, this one here, this is called the medial compartment. So facial septa extending between the deep fascia of the thigh and the linea aspera of the femur. Remember, the linea aspera is the line that's found on the posterior surface or posterior aspect of the femur. These fascia, or facial septa, divide the thigh into three compartments, which are the anterior compartment, the posterior compartment, and the medial one. Okay? And our topic today is going to focus mainly on the anterior compartment. So, muscles of the anterior compartment, or the muscles found in the anterior compartment, we're just going to name them for now, are going to be called the sartorius. We have another muscle called the rectus femoris. We have three vasti muscles, and each of these is named according to its position. We're going to look at that in a little bit more detail in a minute. We have two muscles. One of them is called the iliacus, the other one is called the psoas. And because these two muscles have a similar insertion, so they have two separate origins, but they have a similar insertion. So usually what we do is we just kind of group those two muscles together, then we call them the iliopsoas. And then the last muscle is called the pectineus. The pectineus is, if you notice, I've put a little asterisk next to it. The pectineus is technically part of the medial compartment, but because part of it kind of comes into the anterior compartment as well, and then we're going to need it later when we talk about the femoral triangle. So I've included it in here, okay, just because it shows up, but it will get mentioned again in the medial compartment. Okay, so before we get into where the muscles are found, okay, or which is which, all right, I just want you guys to remember the two major or basic rules of any muscle action, and these are that the muscles always, as you know, have 2 points of attachment, which are the origin and the insertion. If you want to figure out what a muscle does, always remember that the insertion moves towards the origin. So basically the origin stays stable, and the insertion is the part of the muscle that kind of moves or pulls the bone. So if you know where the origin is and where the insertion is, you can kind of figure out what the muscle does. The other rule of muscle action is that if a muscle crosses or crosses any joint, then it will automatically move that joint. So if it crosses more than one joint, it will act on both of them. If it only crosses one joint, it'll only move that joint. So as long as a muscle crosses a joint, it will move it. Okay, so what we're looking at here is a representation of the anterior compartment of the thigh. Clearly you can see that there's a couple of muscles happening here. There's like a huge set of muscles. Okay, so let's just look at them individually. Okay, so the first one I want to look at is this one here. All right, where you notice that it kind of starts up here with the hip bone, okay, specifically the anterior superior iliac spine, and then it passes down across the anterior compartment, and then if we follow it all the way down, it kind of attaches to a point down here in the tibia. Okay, so it basically starts up here at the hip joint or above the hip joint or anterior to the hip joint. Okay, it crosses the hip, it passes all the way across the anterior compartment, and then it eventually ends up reaching the knee joint. Okay, so keep that whole muscle crosses a joint and therefore will move it rule in mind. Okay, this muscle is called the sartorius. Okay, so the sartorius is one of the muscles of the anterior compartment that crosses two joints. It crosses the hip and it crosses the knee. Okay, so automatically it's going to work on both of those. Okay, its origin is up here, its insertion is down here, so you can kind of figure out, if you think about it, what kind of action it will do. Okay, so that's your sartorius. Okay, the next muscle I want to look at is this central muscle here that's passing down the middle of the anterior compartment. Okay, it's relatively wide. All right, it also has an origin up here with the hip bone, and we're going to talk about its insertion later on. But the muscle that passes down the middle of the anterior compartment of the thigh superficially, and you're going to understand why I said that in a minute. Okay, this muscle is called the rectus femoris. Okay, now the term rectus generally means something that is straight. Okay, so you can see that this muscle passes. Where's my cursor? Dude, seriously, my cursor. Oh, there it is. Okay, so you can see that this muscle passes straight down the thigh, so that's why it's called rectus. And then femoris obviously comes from the fact that this is the thigh, and the femur is the bone that is found here. Okay, remember this muscle is superficial, meaning that once you've removed the skin and the deep fascia and the fatty layers, okay, the first muscle that you find passing down the middle of the thigh is going to be called the rectus femoris. Okay. Now, if you remember, I told you there are 3 muscles in the thigh that are called the vasti muscles, and they are named according to their position. So basically, according to which side of the thigh they're found on. Okay. So just to orient you a little bit, this side is the lateral aspect. Okay, and this side is the medial aspect. So you notice how you have one muscle on the medial side. You've got another one in the middle here, and then you've got another one on the lateral side. Now these 3 muscles are going to be named the vasti, like I said, and then each one is given an individual name based on its position. So for this one, on the medial side, okay, we're going to call that the vastus medialis. Okay. The one on the lateral side is going to be called the vastus lateralis, and the one in the middle is going to be called the vastus intermedius. Okay? Now, if you remember just a few seconds ago, I said that we have a muscle that passes straight down the center of the thigh. Notice how the vastus intermedius also kind of passes down the middle of the thigh. Okay? The only difference between these 2 muscles is that this one is superficial, meaning that as soon as you dissect the thigh, this would be the first one that you'd find. And then in order to reach the vastus intermedius, you'd have to push the rectus femoris out of the way, and then you're going to find the vastus intermedius right underneath it. Okay? So, like I said, this is the vastus lateralis, and I think I messed up the order. Yeah, I did. Okay, these 2 labels are going to show up in a minute. Okay? All right. So, this muscle, okay, if you guys remember earlier, I said we had 2 muscles that had 2 different origins, but they inserted into the same place that we called separately the iliacus and the psoas, and together we referred to them as the iliopsoas. Now, the iliacus actually originates from or is attached to the inner surface of the ilium. That's why it's called the iliacus. Okay, and the psoas comes from the posterior abdominal wall, so kind of just up in this region here. And then the 2 of them pass down together and they have a common insertion, so we're going to call this together the iliopsoas. Okay, now this muscle here, okay, is the one that I said is kind of technically counted as part of the medial compartment, but we bring it in here because we're going to need to explain it later. Now, if you notice in this picture here, they've kind of cut out the iliopsoas, and then they're showing you this muscle directly underneath it. So if you want to see it in this picture, it's this one here. Okay, and that is your pectineus. All right. And like I said, I'm sorry I mixed up the order of the labeling, but this is your vastus intermedius found directly beneath the rectus femoris, and then you've got the vastus medialis here. Okay, so those are the muscles of the anterior compartment and how they are arranged in that compartment. Okay, so one of the important things that you need to know is that the 4 muscles that are found in the anterior compartment, kind of in the same region, which are the rectus femoris and the three vasti, are usually grouped together under a common name called the quadriceps femoris. Okay, so quadri obviously means four. Okay, and we've got four muscles here, the rectus femoris and your three vasti. So together we call them the quadriceps femoris. Again, femoris comes from femur. Okay, and one of the reasons that they're actually grouped together is that they have a common origin. Okay, so separately they have a common insertion, not a common origin. I'm sorry. Okay, separately they have different origins. So each one comes from a specific place. Each one has its own origin, but then together they have a common insertion. Okay. And in order for this insertion to be formed, the lowermost fibers of the muscles kind of need to fuse together to sort of form what we call a common tendon. Okay? And so what happens is you're going to have the rectus femoris in the middle here. Okay, and then obviously behind it we've got the vastus intermedius. And then here you've got the vastus medialis, here you've got the vastus lateralis. Notice how these three green areas, in addition to the intermedius underneath, are kind of fusing together to form one single tendon. Okay, now what that tendon is called the quadriceps tendon. Okay, it's also referred to as the patellar tendon if you want. Okay, because what it does is that once the fibers are fused together, okay, they pass on top of the patella, so they go over the patella. Okay, that's why it's called the patellar ligament or the patellar tendon. All right, and then together, after they pass over the patella, they pass down as a single tendon to be inserted into the tibial tuberosity. All right. And so all four of them, like I said, they form a common tendon, the patellar tendon or the patellar ligament, passes over the patella and then inserts into their common insertion, which is the tuberosity of the tibia. Okay? So that means that these four muscles together cross the knee joint with their common insertion, and then they insert into the tibia. Okay? So, normally, in a classroom setting, I'd have this as form like a sort of discussion, okay? But the main action of the anterior compartment muscles is what we call extension of the knee, okay? And extension of the knee is basically straightening out the entire knee or just making it straight in the sense that, you know, the position that your knee is in when you're standing or when it's just completely straight. And if you think about it, we said that the quadriceps femoris have a common insertion in the tibial tuberosity. That means they cross the knee joint. And remember, the insertion always moves towards the origin. So they were all originating from some region either up in the hip bone or the femur. So that means that their role is to pull the tibial tuberosity closer to the superior region of the origin. And when you pull the tibial tuberosity a little bit upwards, then that means that the knee is going to end up being in a straight position, which is extended. Okay? Now, this is the table that summarizes the origin, insertion, nerve supply, and action of the muscles. Okay, I'm not going to get into the specific details. I kept it here because I think this is a little bit clearer. The muscles are not as many as they were in the hand, so that's why I felt comfortable leaving it here. Okay, these are all the muscles of the compartment. Remember that if a muscle crosses more than one joint, it's going to act on both of them. So keep in mind that the sartorius crosses the hip and the knee, so that means it works on both of them. The iliacus and the psoas only cross the hip joint, okay, so they're going to act on that joint and so forth, okay? So that's all we have about the muscles, okay? So just make sure you go over the different names, make sure you can identify where each one is found, and then you know, go through the tables and memorize the different attachments and action. Okay. Next, we're going to look into the blood supply of the anterior compartment. And this comes from an artery called the femoral artery. Now, the femoral artery is a continuation of something called the external iliac artery, which actually comes from a termination of the abdominal aorta. Okay, generally what happens is that the external iliac artery passes into the thigh or into the anterior compartment of the thigh by passing behind the inguinal ligament. This is usually midway between the anterior superior iliac spine and the symphysis pubis. Okay, so let's look at all of that, what was just said, okay? So this is the ilium up here, okay? This is the anterior superior iliac spine, and then this is the region of the pubic bone and symphysis pubis. Now, extending between the anterior superior iliac spine and the symphysis pubis, you have a ligament, which is called the inguinal ligament, okay? Now, up here in the pelvis, you've got the external iliac artery, okay? Once it passes behind the inguinal ligament, I'm going to change its name into the femoral artery because now it's officially in the region of the thigh. So don't think of it as a branch, it is just a continuation. So it's the same artery that went from one place to another. It went from the pelvis and down into the lower limb. Okay, so once it passes the inguinal ligament, okay, we're going to call it the femoral artery. Okay, now once the femoral artery has passed into the thigh, what it does is that it gives off a major branch called the profunda femoris artery, similar to the profunda brachii. Okay, now what the profunda femoris artery does is that it gives off multiple branches. Okay, some of them are going to end up supplying the hip joint. Some of them are going to pass down to give supply to the knee. Okay, and some of them, which are called the perforating branches, these actually pass to supply the posterior compartment of the thigh. Okay, so this is the profunda femoris artery here. It's giving off multiple branches to various places. We'll talk about that in more detail when we take the blood supply of the lower limb. And it also gives off perforating branches that pass to the posterior compartment of the thigh. Okay, and in the meantime, the main femoral artery is going to continue down the anterior compartment of the thigh. It's going to give off blood supply to all the structures in that region. Okay, and then it's going to have a completely different pathway. It's going to pass through something called the adductor hiatus, which you will learn about when you take the medial compartment. And then it's going to continue as a different artery called the popliteal artery, which gives off blood supply to other regions of the lower limb. Okay, so remember, you've got the femoral artery as a continuation of the external iliac. It gives off the profunda femoris artery that supplies the posterior compartment as well as other regions of the lower limb. And the femoral artery itself will continue in the anterior compartment, supplying that region, pass through the adductor hiatus, and end up becoming the popliteal artery. Okay, and just like I have a femoral artery, obviously that means I'm going to have a femoral vein. And like I always say, just remember that veins take the opposite route to arteries. So the femoral vein is actually going to start from the bottom of the lower limb as a continuation of something called the popliteal vein. Okay, it's going to pass up the anterior compartments of the thigh along with the femoral artery. Okay, and being the main vein in the lower limb, or mainly the main vein in the thigh, okay, is going to receive several tributaries, especially from superficial veins. Okay, and the most important vein that it receives is the superficial vein called the great saphenous vein. Okay, now the great saphenous vein is the superficial vein that passes up the medial side of the lower limb, and there's an opening in the deep fascia of the thigh called the saphenous opening. And when the great saphenous vein drains into the femoral vein or joins the femoral vein, this happens within the saphenous opening. Okay, so the saphenous opening is there for the saphenous vein to drain into the femoral. And when the two meet, we call this the saphenofemoral junction. Okay, And once the femoral vein has received all the venous drainage from the lower limb, it also passes underneath the inguinal ligament and will continue as the external iliac vein. So with the arteries, I have the external iliac artery continuing as the femoral artery. Here I'm going to have the femoral vein continuing as the external iliac vein. Okay? Next, we're going to look at the nerve supply of the anterior compartment, and this comes from the femoral nerve. The femoral nerve is the largest nerve that comes from the lumbar plexus, and it has its roots coming from the spinal segments of L2, L3, and L4. And similarly, it enters the thigh behind the inguinal ligament, and in terms of position, it's usually found lateral to the femoral artery. So basically, behind the inguinal ligament, I have three major structures passing into the thigh, which are passing underneath the inguinal ligament in general. I've got the femoral vein, I've got the femoral artery, and then lateral to the femoral artery, you're going to have the femoral nerve, which is the major nerve supply to the anterior compartment of the thigh. Okay, so that's all I have for you in terms of the anterior compartment. Remember, we've got the muscles divided into the quadriceps, which are their own four separate muscles, and then you have a few extra ones like the iliopsoas and the sartorius and so forth. Remember that the major source of blood supply is from the femoral artery and its various branches. The venous drainage happens through the femoral vein, and the source of innervation to the muscles of the anterior compartment comes from the femoral nerve. Okay, so that's just a summary, and apparently today I felt like giving you guys a little positive boost. So, one of my favorite concepts to live by is that you should never pay attention to what people are saying or judging you, because they're going to do it regardless of what you say. So the best thing that you can do is ignore them, and if people are doubting how far you can go, just ignore them and go so far that you can't hear them anymore. So I hope that session was useful for you, and I will see you guys in the next video.